If I have a black female surgeon, my first assumption will be this person had to meet lower standards because
that's just because you're racist and sexist. I mean, the data shows that if you're cared for by a female surgeon, you're more likely to have a better outcome.
I'm a black nurse. Of course, when I introduce myself to some patients, they'll still ask me, who's my nurse for the night? I'm a black nurse. Of course, when I walk into the room, they'll automatically assume that I'm housekeeping or someone from the kitchen. Although there's nothing wrong with working in housekeeping or in the kitchen. I'm a black nurse. Of course, they'll ask me, how long have you been doing this for? I'm a black nurse. Of course, when I tell them I'm their nurse, they squint their eyes to look at my badge and make sure. Here you go. I'm licensed and board certified too. I'm a black nurse. Of course, when I tell them that I'm a nurse, they go, wow, which school did you go to? I'm a black nurse. Of course, I've had patients request a white nurse. I'm a black nurse. Of course, people resort to using the N-word when they don't get what they want. Black nurses rock, and we can do it too.
Hello brothers and sisters, welcome back to the channel. I'm hoping that you are doing great from wherever you're watching this video from. There are a couple of things, there are a couple of phenomena that we need to talk about. Now, I don't think this video is a recent video, but it raised concerns and people tried to talk about it. And I think all these social issues are equally important to us because they shape how we think and how we pass this down to other people that come towards us. Now, you understand that for the longest time, Americans generally have the idea of, downgrading or making black people look substandard, maybe through the services that black people offer, or maybe through the careers of black people. And this is what the United States have always been doing to black people. Remember, the United States have always wanted black Americans to prove themselves. And you've heard even black people saying that they have to work 4 times harder than a white person for them to have the same spot as the white person is. Now back to what's happening currently. Carl Tucker Carlson. Tucker Carlson, I think you've seen him so many times talking about all these, debating about Israel, debating about Palestine and all these things. And so he is a scholar in that field. But in a recent interview, when he was being interviewed and he was giving a story that he felt that since he was being treated by a black nurse, somehow he felt that the standard that this nurse offered was a substandard offer. And this raised concerns because people came out for Tucker Carlson. Tucker Carlson revealed something towards the Americans, and people had to talk about it because that's how the United States have always been seeing and treating black people. Black people have been treated because people feel like they're not up to the task, like they cannot do the task, without forgetting that the greatest things that we are seeing today, without forgetting that we have one of the best black scientists, we have one of the best black nurses, just to remind you, black scholars to remind you, and even best black advisors in the world, right? Just not forget that just recently Mr. Donald Trump went to ask for help from a black woman, Candice Rice. So, but how is the United States been taking advantage of black people, making them look like what they're offering is not of standard? Brothers and sisters, I want you to watch this video. People are coming after Tucker Carlson. But hey, watch the video and then I'll be back. We'll discuss this. And as you know, I'm your host and presenter, Agent Stories. And if you're watching me for the first time, I'm asking you to please subscribe to the channel. On my road to 168 subscribers. And I'll appreciate you all for the support that you're giving me. So, let's watch the video. I'll be back.
I really don't want to be canceled for this, but I do have to tell you that the best doctors I've ever had are women of color. And I can't be more specific than that, and I don't want to stereotype, but I do feel like I have enough experience now to where I can say the best doctors I've ever had in all areas, gynecologists, primary care, specifically gynecologists, but like all of them have been women of color, the best ones. And I'm not saying that the other doctors are bad at all, because I think that becoming a doctor is very difficult. I have so much respect for all doctors in general, but there is just something about a woman of color doctor that I really just have the best experience. If I have a bad experience at the doctor, it's never a woman of color. I'm going to tell you that. And I wasn't even going to say this publicly because...
So initially I didn't know how to take this, but I feel like as Black women, we're always on the defensive. When someone's actually giving you a compliment, we need to recognize it and take it. But on the flip side, it does suck that you have to be worried about being canceled for giving Black women a compliment. It should be okay to feel this way. But having to defend yourself on something that is your opinion is kind of sad, unfortunately. But seeing so many people comment on her posts of shared experiences who agree with her is really heartwarming, and it validates that this is a true narrative. Working in a white and male-dominated field is not easy. Yes, we are the minority, but we actually are the most sought out. My overall experience as a Black female doctor has generally been great, but sometimes that gets lost in the everyday challenges that we face and negative experiences that we have. So taking a step back and recognizing the good, the quality that we bring to the table and to our patients is actually really comforting. We are a rare breed, but we have the biggest impact. Women of color are unique. We are special. So thank you for recognizing that.
This person had to meet lower standards because...
That's just because you're racist and sexist. I mean, the data shows that if you're cared for by a female surgeon, you're more likely to have a better outcome. And the shortage of Black physicians in our communities actually harms patient outcomes. And when there is a higher percentage of Black physicians, then especially Black patients have better outcomes. Remember, facts don't care about your feelings. And pushing this rhetoric that having a Black female physician or any delineation of those identities is going to be harmful to our communities is only harmful to maybe your ego. Just say what it is. Because this whole anti-DEI nonsense is just a way to push a racist, sexist rhetoric. That's all it is. And the reason that you all demonize experts and push this anti-intellectual ideology is only so you don't have to pay attention to facts. So you can spew nonsense and then your audience won't even have the wherewithal to fact check you because you've made them deny facts. Your white mediocrity is no longer being placed on a pedestal and you're throwing a tantrum. Get over yourself.
This person...
All right, so we all know where he's going to go with this. So let me tell you what I think when I say Black female doctor. I think of a woman, a Black woman who went through pre-med, a Black woman who went through med school, who took 41 hours of a 3-part licensing exam and passed all of those 3 parts. 41 straight hours, no breaks, right? We're just counting the actual exam time. Went to residency, went to fellowship, took written or oral boards to be board certified in a specialty, worked long hours, was on call, trained with surgeons that most of them don't look like her, and some of them think like Tucker, and got through all of that. And it's so important to understand that so many people don't make the cut. I've seen so many people fall out in this process that just to get through all of that and become a doctor and take care of people, you've earned it. And these tests that we're taking are standardized. So whether you went to Harvard or whether you went to Michigan, these tests are standardized. So these people who don't know how the process works, don't listen to them. If you're interested in becoming a doctor, stay focused. Good luck, and we need you.
This person had to meet lower standards.
That's racism. Yeah. I've already addressed the process that it takes to become a physician in the United States. As a third-year nurse anesthesia trainee, I want to focus instead on the outcomes of Black physicians and of female physicians as a whole. Here's a 2023 study about the patient outcomes of physicians who were assigned female at birth. Results are found here. Don't expect for you to know how to read statistics, but at 90 days and 1 year, people who were assigned female at birth had better patient outcomes. Another 23 study about increasing the number of Black physicians and how that correlates with improved patient outcomes at the community health level. This one shows that for every 10% increase in the number of Black physicians, that the average life expectancy for Black patients in that county increased by 30 days. All of this says that Diversity, equity, and inclusion is not only the right thing to do, but it also improves actual health outcomes for our patients and our communities. Despite all of the barriers that Black physicians overcome to provide health care for patients once they are actually in medicine, they provide incredible outcomes. Yeah, if you're going to make assumptions based off of the race of your physician, you should assume that Black female physicians provide incredible care, and you would be correct to assume that.
See this kind of nonsense. It is the kind of thing that just makes me shake my head. So, because you cannot imagine a Black woman being excellent, that means they're not qualified. You just open your mouth. Wow, you're talking anyhow. Do you know what it takes to become a physician or a surgeon? Do you know the kind of wahala, the sleepless nights, the sacrifices? And yet Black women, they do it, while carrying their families, facing the different biases, and they still excel. Let me tell you something. This is personal because I'm a doctor, yes. But my wife, she is a Black woman, a Nigerian-American woman who was born and raised here in the USA, and she also went through medical school while having a child. She gave birth and still continued pushing, grinding, and she deserved her degree. They didn't dash her degree. And now she's in residency, a mother of two, and saves lives daily. This is similar to a lot of Black women who are medical professionals, and they had to excel and work their behinds off to get to where they are today, in a society that makes it really difficult for Black women to succeed. Do you think that is easy? So evidence has even suggested that female surgeons are more likely to use, patient-centered decision-making and are more willing to collaborate, and that is what every patient should desire. The problem is not Black women's competence. The problem is your small-mindedness. If a Black female surgeon is standing in the operating room, trust me, she has earned her place, and she is probably better than you. So instead of sitting down there spewing ignorance, go and educate yourself, because this one you are doing, it is a pure disgrace.
If I have a Black female surgeon, my first assumption will be this person had to meet lower standards because the school or the certifying board was so anxious to say we have a Black female surgeon.
There are many of Black female surgeons, respectfully, that you could have interviewed before you gave your opinion, but I do understand ignorance isn't bliss. It's often just loud. Cancer research and chemotherapy and preventative care for cancer, especially breast cancer, would not be where we are today if it wasn't for Dr. Jane C. Wright. See, she graduated back in the 1930s or 40s. The board appointed her. Let me go a little bit further. President Lyndon B. Johnson appointed her as the president's commissionary for heart disease and stroke and cancer research because of her qualifications, not the color of her skin. I don't think you understand that degrees weren't just handed out to African American women. Now, I'm for all women, but especially Black women, because Black women, especially Black female surgeons, had to create waves where there were no water. They have been known as trailblazers in medicine today. So let me educate you on a couple of things. Again, respect. Not too sure if you heard of St. Jude's Cancer Center or MD Anderson Cancer Center. Do you know that the reason why we have cancer and chemotherapy and the longevity of cancer patients now is because of Dr. Jane C. Wright? She graduated from New York Medical College in 1945. Her father was the first Black doctor to graduate from Harvard. Back when they weren't looking to give, this was before civil rights, before they were looking to give African American degrees or a seat at the table. But that's a story for another time. Dr. Jane C. Wright progressed after she graduated from New York Medical College to do more cancer research. She was also named the Associate Professor of Medical Surgical Research, as well as the Cancer and Chemotherapy Research Director at NYU. She was so qualified to be in that white coat that President Lyndon B. Johnson appointed her the Presidential Commissioner over heart disease and strokes and cancer research. She was so qualified that she later became the Professor of Surgery and head of the cancer research. She was ranked the highest paid surgeon back in those days. And she's also mentioned in many medical institutions now. So I'm not sure why you would feel that if you saw a Black female surgeon, you would think that she got in because she was Black. They wasn't giving us degrees back then. But I'll digress. I'll take you one further. Dr. Myra Lang was the first Black female surgeon to perform a heart surgery, the 9th of its kind in the world, okay? When you see Black female surgeons or Black medical professionals or Black educated women, please put some respect on their name, because they fought Goliaths that you wouldn't have the strength to stand against. They never had a seat at the table, so they had to build buildings. And they had to create doors so that other Black female medical professionals and professionals everywhere could have a seat at the table that they also built. So I hope that this helps with the assumptions that you have. And you know, they say that we shouldn't assume, because when we do, we make a donkey of ourselves. I hope that helped with your assumptions, Tucker. You be blessed now.
If I have a black female surgeon, my first assumption will be this person had to meet lower standards because the school or the certifying board was so anxious to say we have a black female surgeon. And of course, it's unfair to the individual, but then the whole system is unfair.
What Tucker fails to realize is that at no step of the process through med school, board exams, residency, fellowship, or any of the other certifying steps do they say, oh, you're a black female, we'll treat your performance differently. Becoming a surgeon is one of the most merit-based career paths I could think of. I actually don't think I could come up with a worse example of alleged DEI than a black female surgeon. In reality, I would have guessed the opposite as Tucker. The black female surgeons have to have more fire, more passion, have to grind a little bit harder, because I feel like you have to fight to progress in this career, despite facing this exact type of bias all the way through. And the surgeon that he was speaking with on this show, Bosshart, is even worse, of course, and instigated all of this topic. I never hear people talking about whether white male surgeons may have only gotten a spot in their medical training due to nepotism or legacy admissions, and therefore be less skilled. Now that I've berated Tucker, this does raise an important point. Some people, when they go to their primary care provider or their OBGYN or any doctor, they may feel more comfortable opening up if their doctor maybe looks a little more like them. Or maybe, for example, some women may feel more comfortable working with female OBGYNs for reasons unrelated to the perceived test scores or competency of male OBGYNs. And you know what? I think that's fine. You want to find a doctor who you feel so comfortable with, you can be 100% open. Now, the key difference from what I've just said versus what Tucker said is Tucker saying he thinks that black female surgeons may be less skilled because he's worried about special DEI access and different standards. What I'm saying is that some people may feel more comfortable opening up to doctors who look a little more like them. In fact, this is why having a rich diversity of healthcare providers is so valuable. You want to have a mix of providers so everyone can find someone they feel comfortable with. For some people, that can help improve trust, which improves communication, which may help improve health outcomes. And by the way, the Tucker Carlson Network happens to have 1.2 million followers. Coincidentally, so do I, which means I'm going to need you to hit the follow button so that next time I can flex a bit more on Tucker for no reason.
Let's talk about something real for a second. When people assume that a black woman in a high-level job like a surgeon or even OBGYN only got there because of lower standards, what they're saying is she couldn't have possibly earned it. It took me 11 OBGYNs to finally get diagnosed with PCOS, endometriosis, and adenomyosis. 11 doctors. 11 times I was told, it's just abnormal bleeding, lose the weight, you'll be fine. And guess what? The 11th doctor who finally diagnosed me is a black woman. She told me that if the other doctors had known what they were doing, I could have been diagnosed years earlier. I'm talking almost 10 years earlier. And I may have been able to save my fertility. So when people tell me that black women only got there because of lower standards in the medical field, tell me why the first 10 doctors that failed me were white women. White women with the same degrees. And why was my black doctor the only doctor able to do her job? And instead of assuming someone doesn't deserve their spot, maybe ask yourself why you're so uncomfortable with them having it. Merit isn't just for one type of person, and stop acting like it is.
Produces unfair results? No. I mean, it's unfair.
This is completely incorrect. In order to become a board-certified surgeon, whether it's a general surgeon or a plastic surgeon like myself, we have to pass written board exams as well as oral exams. They don't give you preferential treatment or allow you to pass exams at a lower score based off of your gender or your skin color. And the truth is, you may have to work actually harder to become a board-certified surgeon if you're a female or especially an African-American female. And this is because in order to be accepted into that program, you have to be ranked high on their list of desirable applicants. And they look at all sorts of factors, including your board scores, how hard you work, and how much personally they may connect with you. And the fact is that the program directors, the surgeons that make these lists of the most desirable candidates to become surgeons are overwhelmingly male and white. So whether you have a good or a bad surgeon is not based off of their gender or their skin color.
Hello brothers and sisters, welcome back to the channel. I'm hoping that you are fine. Now, a perfect reason, a perfect example, and I think this is how the United States is good at making black people feel about them, because white people are tuned to, like, they have this superior complex, like, you know, I'm a white person, you're a black person. What are you trying to do? one thing is that I don't expect you to be in this field because they don't expect to have black educated women. They don't believe that can happen. And that's all that the political regime of Mr. Donald Trump wanted. Mr. Donald Trump wanted all these groups of people to be so much patriarchal. And of course, this is what is a problem. The problem is you are making some group of people feel like they are less. And you know, the American history has always been doing this to black people. American has the tendency of always wanting black Americans to prove their worth, to prove themselves, to prove that they can hold and do certain tasks. So black Americans have been living, proving one place to another. But here's one thing that I like to say. I like to say this. Sometimes you might think that you want people to prove you something. But did you know that this is just part of jealousy? Yes, it's jealousy because it might look like you are insecure or you don't trust a black nurse or anything. But let me tell you, we have one of the best, amongst the best, out of the best, in the best black nurses who are black. Yes. And another thing is that I was talking about jealous, right? Jealous of not believing or not accepting that you are seeing a black person taking all these spots that at the back of your mind you thought all that you believed that belonged to you. So when you see all these things happen, you are left but to question yourself. You are left but to start thinking about how you are gonna fathom this. Because according to what you're used to, you are used to seeing white people in these spaces, and now you're seeing a black woman, and some of this is irritating you. So you are not happy about it. And for the longest time, that's the United States for you. Because we have a group of people that fail and think that they deserve a space, a given space, as compared to a given space. And there is this stereotype that, you know, black Americans, you represent us in entertainment. But when it comes to medicine, when it comes to serious things, we ain't gonna be seeing you. There's a stereotype that black Americans are the entertainers of the United States. While that is true, because black people, it's not a lie, black people have, you know, managed to show the world that we are the most talented group of people. But hey, it doesn't just end there. You know where it goes? Literature, medicine, politics, psychology. We have had one of the best black doctors, best advisors, best of the best. So I honestly don't know where all this jealousy is coming from. Because you might see, you might just take something for granted because, oh, it's just a black person. I don't trust these folks. Their cognitive dissonance cannot allow them to see a black person, see a black woman thrive in a space where they thought that should be a space of a white person. Honestly, if I was to be in a hospital and I'm in the United States, I'll feel safer to be operated by a black nurse. I mean, it's not that I'm being racist or anything, but if you know, you know. If you know, you know. So all that they are saying in regards to like not trusting a black woman or seeing a black nurse because they think that they'll offer substandard work or anything, I don't think that really works for me, honestly. Because as I said, I would like to be operated by a black nurse. Come on. At least I'll be safer. They understand me. They resonate with me. And I'm sure, because the nurse that I'm seeing is a black person, he has to work like 4 times better than any white nurse that you're seeing in those places. So trust me, who will you trust? If you had a chance to go to a hospital, you know the answer, right? So let's just stop all these games that these folks are trying to play. So brothers and sisters, hoping to see you on my next video. But until then, peace, love, and harmony. Salute.